A health alert as we get closer to the holidays. Pertussis, also known as whooping cough, has hit an 11-year high. And we've told you on Daybreak before that there have been more than 3,500 cases so far this year.
And now Austin ISD warning families about cases in the school district. KVUE's Allison Martinez joins us here in the studio with what you need to know to try to keep your family healthy. Good morning, Allison.
Brian and Yvonne, good morning. The Texas Department of State Health Services has issued a health alert after seeing a significant surge in cases. Right now, the state is seeing 4 times the number of whooping cough cases compared to this time last year. Now, this time of year brings more travel, family gatherings, and close contact. Doctors say that means more viruses spreading, including flu, RSV, COVID, and pertussis. So people should pay close attention to symptoms and take steps to protect themselves. The state health department says vaccination remains the best protection against all of these respiratory illnesses. They recommend checking with your healthcare provider to make sure you're up to date.
Other things to think about is, really pay attention to your body. If you're starting to feel sick, stay away from other people, keep your child out of school if they're sick, and reach out to your doctor.
Dr. Varun Shetty says there may be treatments available to shorten your illness and keep you out of the hospital. Austin ISD sent an email home to families writing, "There are several cases across Austin ISD campuses. We know of at least 1 case at McCallum High School and several cases this school year at Lamar Middle School." In an email to parents, the school's principal said it's working closely with health officials to ensure the safety of all students. The DSHS warns that more than half of last year's whooping cough cases were reported in November and December, so they expect numbers to keep rising as we head into the end of the year. Reporting live in the studio, Allison Martinez, KVUE News.